Assalamualaikum, my name is Ameeshah and my matric number is 2023-607-024. So I will going to explain about the liver. What is liver? The liver is a vital organ in the human body that located in the upper right quadrant of the abdomen with beneath of the diaphragm and also above the stomach and also intestine. The liver consists of two main lobes which are divided by the right lobe and also left lobe and divided by each ligament. Each lobe is further segmented into smaller units called lobules, which are connected to the networks of ducts that transport by. Blood supply to the liver comes from two primary sources, which is hepatic artery and also hepatic portal vein. There are five main functions for the liver, which is by-production, including metabolism activity, detoxification, protein synthesis and also storage. For the by-production, the liver produces bile which aids in the digestion and also absorption of fat in the small intestine. And for the metabolism, it metabolizes carbohydrates, proteins and fats, converting excess glucose to the glycogen for storage and regulating blood sugar level. Detoxification, which the filter toxins, and also for the protein synthesis, it synthesizes important proteins for blood, plasma including albumin, and for the storage, the liver stores vitamins, minerals and also glycogen for energy.
Bismillahirrahmanirrahim. Assalamualaikum and hi to Madam N and my fellow friends. My name is Ameeshah and for this presentation I'm going to discuss the introduction of hepatocellular carcinoma or HCC. First of all, HCC is a primary liver cancer that most commonly associated with cirrhosis causes by alcohol consumption, hepatitis B or C infections or metabolic disorder like fatty liver disease. It is one of the leading cause of cancer-related death globally. Unfortunately, the 5-year survival rate for HCC is only 80%, largely because it is often diagnosed late, when treatment options are very limited. Early detection is the key for HCC when tumors are detected at 2 cm or smaller. Therefore, we can increase the survival rates exceed to 70%. Despite this, many high-risk patients such as those with cirrhosis or chronic liver disease are not regularly screened. This lack of screening is a major challenge in reducing the burden of HCC. In conclusion, HCC is a deadly but prevented cancer if caught early. Increasing awareness, improving screening programs and detecting tumors at early stages can save lives. That's all from me. Thank you for your attention and have a nice day. Assalamualaikum warahmatullahi wabarakatuh and goodbye.
Hi and Assalamualaikum. My name is Muhammad Ahmad Mustaqim. Today I will explain about the sign and the symptom. So the sign and symptom for the HCC is the cirrhosis. Cirrhosis is the condition where it will cause severe scarring of the liver. It causes usually because of the liver disease and alcohol abuse. Second one is the abdominal pain. For the abdominal pain, usually it will cause on the right side because the liver is on the right side of the body, same as the lumps. But because if the lump is severe, if the HCC is severe, you will see the lump at the right side of your body. Next is the fever. For the cancer treatment, usually it will weaken the immune system, making it more susceptible to the infection. That's why patient will have the HCC that undergoes the cancer treatment usually get the fever. HCC also sign and symptom also make the patient it more easy to get fatigue, and lastly it will cause jaundice because of the liver will because of the accumulation of the bilirubin on the liver, because livers cannot synthesis the bilirubin. So because of the cancer, then the patient will have the jaundice.
Hi everyone, my name is Elijah Nathaniel Supes Anabain, and now I'm going to present about a CT scan where it is commonly used for to diagnose this kind of condition. Where first it is a fast imaging technique, where this technique will only conduct few minutes to complete. Then it has 4 phases, where first one is the plain or also known as non-enhancement phase, and then next we'll have the arterial phase, then portal venous phase, and lastly is the delay phase. In some cases, sometimes radiologists will request late atrial phase where it is atrial phase but it does not uh, reach to the portal venous phase. It means it's in between atrial phase and also the portal venous phase. Then the third one will be the multiplanary formats where usually we scans in axial views, but with this kind of reformats we able to view the images or this patient in sagittal or coronal view. And lastly is the identifying elements, whereas we know in CT scans there is one CT scan known as the ECT or known as dual energy CT. It can help us to identify is are there any different elements such as calciums in the parenchyma of the liver or also maybe iodines. That's all for me. Thank you.
Hi, Assalamualaikum. My name is Ahmad Asfa bin Azhar and I will continue my presentation about the normal CT appearance of the liver. The liver is divided into lobes and segments by anatomical landmarks, with the right lobe being larger than the left. The portal and hepatic veins divide the liver into segmental anatomy that allows radiologists and surgeons to be very specific about the locations of different lesions or any abnormalities. The hepatic veins and falciform ligament divide the liver vertically, whereas the portal veins divide the liver horizontally, together forming 8 segments. So, by understanding of how each phase in the CT scan should appear is important. Late arterial phase begins after 15 to 30 seconds post-bolus triggering. The portal vein will be enhanced without hepatic venous enhancement. Hepatocellular carcinoma may only show enhancement in the late arterial phase. So, this is very important. In portal venous phase begins after 60 to 75 seconds post-injection. Portal veins, hepatic veins will be enhanced during this phase. And for the delayed phase, that will occur 2 to 5 minutes after injection will show us the portal and hepatic veins slightly enhanced by a lot less than the portal venous phase. For the next part, we look into the neighboring structures of the liver. Superiorly, the liver lies beneath the diaphragm, with the dome of the liver closely abutting this muscular structure, which is the diaphragm. Inferiorly, the gallbladder sits in a fossa on the underside of the liver, while parts of the colon are adjacent to its lower border. By looking at the axial view, anteriorly, the liver lies adjacent to the anterior abdominal wall, including muscles like the rectus abdominis, and is covered by the peritoneum. Posteriorly, the liver is bordered by the inferior vena cava and the diaphragm.
Assalamualaikum, my name is Nora Najwa binti Roslan, and now I'm going to present about the abnormal CT liver. So this is an axial portal venous phase image from a 35 years old female patient with a history of splenomegaly and also a moderate cirrhosis. The liver demonstrates a multiple masses with arterial phase hyperenhancement, indicative of the hypervascular nature, consists with hepatocellular carcinoma (HCC). The largest mass originating from the inferior aspect of hepatic segment 3 extended anteriorly into the abdominal cavity along the anterior inferior margin of the lesion. A few prominent abnormal varices are noted. And the omentum appear hazy, which is the blue line that I draw, which is you can see the omentum appear hazy. In the portal venous phase, these masses exhibit relative washout, appearing hypodense compared to the surrounding liver parenchyma, which is a classic imaging feature of HCC. And by that, we can see that I already circled the yellow circle, which is indicate where is the masses with the hypodense compared to the surrounding liver parenchyma. Next, I'm going to move on into a coronal portal venous phase. On this phase or on this image, there is a large hepatic lesion extending beyond the confine of the liver capsule. Besides that, there also a multiple smaller focal lesions are visible throughout the liver parenchyma. And all of these lesions appear hypodense relative to the background liver on the portal venous vein. And as we can see on the yellow circle, the masses extend from the liver inferiorly into the abdominal cavity. Move on to that, and this is a sagittal portal venous phase image, which is in this image it highlight the inferior extension of the hepatic masses, demonstrate a clear exophatic growth beyond the liver capsule. This feature is characteristic of advanced hepatocellular carcinoma and suggests that local invasion into adjacent structure in the abdominal cavity. The hypodense appearance of the portion of the mass is portal venous phase may reflect area of tumor necrosis, likely due to insufficient vascular supply in the large tumor region.